Namaste and good afternoon. Greetings from all of us at Apollo Hospitals. Welcome to the Freedom from Diseases series presented by Apollo Hospitals. This is Dr. Srinidhi Chidambaram and I'm very happy to see all of you. I do hope you've been staying safe and well.
Namaste and
Freedom
good
from
afternoon.
Diseases discusses common medical conditions, latest technologies, innovations, and path-breaking treatments so that you can obtain freedom from diseases that are hindering your good health. The retina is a thin layer of tissue on the inside back wall of your eye, and it has millions of light-sensitive cells, which are called rods and cones, and other nerve cells that receive and organize visual information, what you see. Your retina is what sends information to your brain through your optic nerve, enabling you to see. Retinal disease is a leading cause of blindness, and early detection and treatment is the game changer. Pay attention to visual changes and visit an eye specialist right away if you experience symptoms such as blurry or distorted vision, or if straight lines appear wavy, or you see flashing lights, dark spots, etc. There are several amazing innovations in the treatment of retinal disorders, and they can help you achieve freedom from retinal diseases. To discuss these in detail with us, I am delighted to welcome Dr. Abhishek Hoshing. Dr. Abhishek Hoshing is consultant ophthalmology and a corneal transplant surgeon at Apollo Hospitals, Navi, Mumbai. He's a renowned corneal transplant surgeon practicing in the Navi Mumbai region for the past 5 years. He completed his residency training in ophthalmology from the CMC Vellore and subsequently worked as an ophthalmologist for a year, and then pursued his long-term fellowship training in cornea and anterior segment diseases of the eye at the LV Prasad Eye Institute at Hyderabad. His primary areas of interest are simple and complicated corneal transplants. He's trained extensively in the techniques of full thickness and partial thickness corneal transplants and has performed more than 500 such surgeries in a short span of 5 years. He also performs surgeries involving artificial cornea implantation and is also keenly interested in the management of complicated ocular surface diseases and treating severe chemical injuries of the eye. He's treated many such patients with modalities like amniotic membrane transplants and mucous membrane transplants. He's also an ocular trauma surgeon and has many scientific publications to his credit in various journals, and a reviewer for the Indian Journal of Ophthalmology, Journal of Clinical Ophthalmology, and also the official journal of the Maharashtra Ophthalmic Society, and has also conducted and participated in several seminars in ophthalmology. Welcome, Dr. Hoshing. I'm so delighted that you're here with us today in our FB Live session, and I look forward to discussing with you and understanding what retinal disorders are and what are the latest treatments so that people can gain freedom from them.
Thank you, Dr. Srinidhi, and I'm glad to be here. Thank you for having me and making me a part of this session. So, briefly, like you said, we are going to discuss about the retinal diseases today. And retina, as you rightly said, is a light-sensitive layer at the back of the eye. And if you had to compare it to, let's say, a camera, then the retina is actually the sensor of the camera, or the film of the camera, if one is from an older times. So the retina is what gathers the light information, converts it into electrical signals after having interpreted various functions of light, namely the color, the brightness, the direction of the light. And these electrical signals are then conducted through its nerve fibers and sent to the brain for further interpretation. So retina plays an extremely vital role for us to see and also for us to interpret what we are seeing. So that is the thing that retina is. And today we are going to briefly discuss about the various aspects of retinal disorders. So yeah, Dr. Srinidhi.
Yes. Could you we can begin by talking about what are the common retinal disorders that can occur?
Yeah, so the common retinal disorders in our country are usually diabetic retinopathy, which happens in patients who are suffering from diabetes, both type 1 and type 2 diabetes. We also have a hypertensive retinopathy, which means patients are having retinal changes secondary to high blood pressure. These patients may also in future develop some retinal vein occlusions, which means the small blood vessels which is supplying the blood and taking the blood away from the retina, they may get blocked due to certain conditions, which can lead to further vision problems. We also have retinal detachment, in which this layer detaches itself from its normal location, and that itself can lead to severe vision loss and needs to be treated as urgently as possible. We also have a very relatively new onset for India condition, which is known as the age-related macular degeneration, which we are seeing more and more in a lot of elderly population. And then we have a lot of inflammatory and infective diseases of the retina, which can be caused by either injuries or some infections which have spread to the retina from the blood, or it due to some sort of surgery which has gone wrong. So those are the most common retinal diseases that we usually encounter in our practice.
Before we go on to the symptoms, could we talk a little bit about diabetic retinopathy, because this is something that is so common, and could you tell us a little more about it in terms of particularly how this happens, and is there any way to prevent it, because there are so many people with long-standing diabetes in our country.
So to put it simply, diabetic retinopathy is a result of the small blood vessels of the retina, which supply blood to all the tissues of the retina, getting affected. So diabetes as a condition has this tendency of affecting the blood vessels in all parts of our body. Similarly, it affects the blood vessels in the retina. And these blood vessels then undergo certain changes. They can either balloon up, they can sometimes block off, leading to some areas of the retina not receiving its adequate amount of blood supply, and this in turn can lead to various problems. Now, because the retina tries to gain more and more blood, it produces certain chemicals which are known as vascular endothelial growth factors, and this induces the production of newer blood vessels. But these new blood vessels are ill formed, they are not properly generated, they are leaky, the walls are very fragile, and so they can lead to leakage of fluid within the layers of retina, which can cause swelling of the retina with water, which can cause blurring of vision. The blood vessels may suddenly rupture open, causing massive amount of bleeding inside the eye. So, and these also is associated with some fibrous bands. So these are like bands which have a property of traction, which means they start pulling on the retina, and that itself can detach the retina. So to put it in a nutshell, most of the complications of diabetic retinopathy arise from the fact that it is affecting the small blood vessels of the retina, and then the disease progresses from there. The easiest thing to do to prevent diabetic retinopathy is obviously to have absolute control over the blood sugars. So need to follow whatever instructions the diabetologist has given. They also need to have a healthy lifestyle in form of appropriate exercise, diet control, any comorbid conditions like associated high blood pressures, because most of the times people who have diabetes also may have a high blood pressure or high cholesterol and serum lipid problem. So they also need to be controlled with the equal amount of zest. And that is the way where we can, one, prevent the onset of diabetic retinopathy, and also prevent the progression of diabetic retinopathy and avoid it from getting to a higher stage. Yeah.
So, what are the common symptoms of retinal disorders that one must be alert to?
Yeah, so the symptoms of retinal disorders will depend upon which part of the retina is getting affected. So grossly, the retina may be divided into the central retina and the mid-peripheral and peripheral retina. Now, the diseases of the central retina, the person will become, aware of their problems quite early, because the central retina is the one which is most important for sharp vision. and the blurring of vision will be noticed much earlier. So blurring of vision is one of the symptoms of retinal disorders, like any other disorders of the eye. Apart from that, there can also be distortion in the shape. Objects may, some straight lines may appear wavy, like you said in your introduction. Objects may appear of different sizes. So sometimes an object may appear smaller than it is, or it may appear larger than it actually is. And so these are the usually common symptoms of the central retinal diseases. Diseases of the peripheral retina usually are missed, or they are not, the patient does not become aware of them quite easily because they are not aware of the peripheral vision so much. So, but there will be some amount of field loss, which means that a part of the vision, that a part of their visual field is not visible to them, which they become aware of much later. And sometimes there can also be floaters, which means these small dots or spots are visible in the field of view, especially when somebody is looking at a bright background. Patient may also have flashes, which means someone might feel that a flashlight has gone off in his or her eye, or like a lightning strike inside the eye. So all these are symptoms of retinal disorders. Sometimes incomplete images. So they might feel that a part of whatever they are looking at is missing, like an object of interest, or if a person is looking at another person, then the face might be missing, or the part of a shoulder or hand might be missing. So that is also something which patients do notice in retinal disorders.
And how are they diagnosed? What are the, so once they come to the eye specialist, what really happens after that? How is the diagnosis done?
So, diagnosis of retinal disorders is quite simple actually, because we can directly look at the retina during a eye examination. Unlike many other organs where you cannot really look at the organ, like a kidney or a liver, unless you do an imaging, the retina is directly visible to us unless the patient has a very dense cataract. So retinal examination is a part of all routine eye checkups or all routine ophthalmic examination. One doesn't have to necessarily request for an additional retinal examination, because by default a retinal examination is done by every ophthalmologist. So, and any retinal disease will be picked up by the ophthalmologist and necessary advice would be given to the patient. But if a patient is just complaining of blurring of vision, and still does not know that whether this is due to a retinal cause or some other cause, then a routine, when a patient reaches ophthalmologist, the patient's vision is checked, as if necessary other factors like color perception etc is checked, and then a slit lamp examination is done, which is sort of a magnifying telescope like thing, in which we can see all the structures in a magnified manner. And after that, a dilating drop is put into the patient's eye, so that the pupil, which is the window to the eye, it opens up widely, so we can get a better assessment of the whole of the retina. And a retinal examination is done by this process called fundoscopy. So some people prefer that, or it is also called as ophthalmoscopy. So we either do it by direct ophthalmoscope or indirect ophthalmoscope, depends upon the comfort of the examiner. And so that is done. So, like I said, we can easily look at most of the retinal diseases just by a clinical examination without going into any fancy imaging equipment, etc. But sometimes we do require these imaging modalities also. So we have certain instruments which are especially the optical coherence tomography, OCT for short, which is quite common and very helpful nowadays to look at the layers of the retina and assess what is happening in the depths of the retina, not just on the surface. Apart from that, we also have a angiography procedure of the retina, which basically is similar to a coronary angiography, where a dye is injected into the patient's bloodstream and photographs of the retina are taken and then they are interpreted by specialists. We also have something known as electrophysiological tests of the retina. Most commonly performed ones are the electroretinogram or the oculogram, and also a visual evoked potential test. So this is basically measures the electrical activity which is going on in the various layers of the retina, And to put briefly and just to simplify, it can be considered like a ECG of the retinal tissue. So it is something like that. So similar to an ECG, two electrodes are placed on the patient's head, and then a patient is shown various images and bright flashlights, and then the electrical activity is recorded. So these are the various modalities by which the different types of retinal diseases can be diagnosed.
So, doctor, like you were saying that it's easy to diagnose because you can directly visualize the retina, but there are also these additional investigations. So, could you tell us in what on what occasions would you warrant these additional investigations after the ophthalmoscopic examination?
Yes. So many times we can see, so OCT and FFA or the fundus fluorescein angiography are the commonly used investigation modalities. So OCT is like doing a histopathological examination of the retina without actually touching it or cutting it open. So OCT uses this light, or it is a coherent light, and this light is passed through the layers of the retina, and then it is reflected back, and the machine gathers this reflected light, and based on the properties of this reflected light and its interference patterns, it can actually map the whole of the all the layers of the retina. So it is as if we are able to see the microscopic level details of the various layers or the sub layers of retina. So this will be usually advised if a surgeon wants to have a quantification of how much edema is there, or how much has the retina swollen up, or at what depth am I seeing a particular deformity or lesion. That because that assessment may not be possible in just a clinical examination, and they also help us to document a person's condition, and also help us to subsequently follow them up, and and compare it with their baseline records. And it is an objective method, because the machine will say the same for two different examiners, but two different examiners just by clinical examination may have differing opinions. So that is it. Usually fundus fluorescein angiography, which is another modality, is advised for conditions which deal with retinal vascular disorders, or in which we suspect that there is some problem with the blood supply or the blood of the retina. So this dye basically is a fluorescent dye. That means when excited by a particular light, it gives off fluorescence. So just by assessing where the dye is flowing, whether it is flowing to a particular area or not, and whether a dye is leaking out from some particular area, we are able to assess exactly at what locations these problems lie, and then targeted treatment can be done for those particular areas, instead of just trying to blindly treat the whole of the retina without a proper judgment.
So this check of the eye or the retina, what would you recommend that like people do? Should they have one every year, and after what age?
Yeah, so people who are wearing glasses, especially high minus numbers, they usually get their glass power checked maybe once a year. So my recommendation would be to get this glass power checked at an ophthalmologist, not just at an optician's shop, because an ophthalmologist not only checks the glass power but also does this additional retinal examination. So if they are going for a glass power checkup, they can do it once a year or as requirement is. If a person has been diagnosed to have a certain condition, let's say diabetic retinopathy or hypertensive retinopathy, or sometimes these retina develops some atrophic degenerative areas, then according to what the disease is, the subsequent follow-up interval would be advised by the ophthalmologist. So for early stages of diabetic or hypertensive retinopathy, where there is not much change on the retina, it might be just once a year or once in 6 months if it is advised by the doctor. But if it has gone to moderate level disease, or sometimes even beyond severe, then a much more frequent follow-up might be required. It could even be like monthly or 3 monthly, depending upon the severity of the condition, and also the patient's other eye status, like what is the status of the other eye, whether it has already suffering from a serious condition or not. So there is no fixed rule to what is the ideal duration of follow-up for retinal diseases. It will depend from a case to case, on a case-to-case basis, and also what condition the person is suffering from. So that it would be like that.
The next thing is about particular retinal diseases. We spoke about diabetic retinopathy. The other condition that is common is the retinal detachment. So could you tell us about this condition?
Yes. So retina, if you look at the retina, it also has various 10 sublayers. So retina can be considered as one layer of the eye, but there are 10 sublayers of the retina. So the outermost sublayer of the retina is called the retinal pigment epithelium. And then everything inside that is called a neurosensory retina, which has the nerves. And the pigment epithelium is what is basically supplying the nutrition and clearing away the waste of the retinal cells. So there is a potential space between this pigment epithelium and the neurosensory retina. And sometimes if there is a break or a tear in the retina, either due to injury or any sort of a degenerative condition, then fluid might enter in this potential space between the retinal pigment epithelium and the neurosensory retina. And the two layers sort of go away from each other, and the neurosensory retina detaches. So that is essentially retinal detachment. Retinal detachment can cause severe vision loss if it is involving the central part of the retina. And retinal detachment usually requires a early treatment. I mean, sooner the better. If we operate on them sooner, we are bound to get better results than waiting upon it. So there are various reasons for retinal detachment. It could just be an injury, some sort of an injury or a blunt force trauma, or some sort of penetrating trauma in which something has poked inside the eye that can lead to a retinal detachment. And even advanced stages of diabetic or hypertensive retinopathy or vein occlusions can cause these tractional bands which pull the retina off. So it is like a band which is stuck to the retina and it is getting pulled off it. So that is called a tractional retinal detachment. So that is retinal detachment can lead to severe blinding conditions.
So this needs emergency medical attention. And how is it treated by surgery?
Yes. So treatment for retinal detachment is essentially surgical. It's not a medical treatment at all. We need to operate. Depending upon the location, the extent of detachment, and the patient's other ocular comorbid conditions, the surgery might be done either from an external route, that is done only on the surface of the retina, which is called a surface of the eye, which is called a scleral buccal procedure, or the more commonly performed procedure, which is called a pars plana vitrectomy, in which a surgeon goes inside the eye and then operates from inside the eye to reattach the retina back to its normal location.
The next thing is the age-related macular degeneration that you were talking about. So could you give us some details about it, a little further detail?
Yes. So age-related macular degeneration. The name actually says it all. First of all, it is age-related, which means that one of the causes is advanced age. So now that we have increased life expectancy, more and more people are living beyond their 80s and sometimes even beyond their 90s. So with time, the retinal pigment epithelium, which I told you was the layer which supplies the nutrition, and a membrane below that, which is called the Brooks membrane, it undergoes degenerative changes, which means it just sort of starts wearing off because of its prolonged usage. And then because of this loss of retinal pigment epithelium and the underlying Brooks membrane, there is a problem with the nutritional supply of the retina. There is a problem with the clearance of all the all the materials of, I mean, which need to be cleared away, the waste material of the retina, and which start getting deposited. And slowly basically because this is not happening, there is no appropriate nutrition, no appropriate waste clearance, that it also starts affecting the retinal cells, and the patient starts losing vision. The problem with this is it affects the central retina, which I told you was the most important for having sharp vision. It affects the central retina most commonly or almost always. And because of this, the vision loss becomes quite severe, quite debilitating because the person can't see what they want to see. And it can also become, and unfortunately, sometimes it becomes an irreversible vision loss. There are grossly two different types of age-related macular degeneration: the dry variant and the wet variant. The dry variant usually can sometimes also progress to the wet variant. And in the dry variant, there is no fluid collection in the layers of the retina, just that the cells keep dying off, more and more cells keep dying off, and they form this large area where there are dead cells, which is known as a geographic atrophy. So atrophy basically means death of cells, gradual death of cells. And wherever that area of geographic atrophy is, that those areas of the retina become non-functional, and because it involves the central retina, a large amount of vision is lost. The wet variant is where abnormal blood vessels start growing in from the outer layers of the eyeball, and they, because again, like I said, they are abnormal blood vessels, they are leaky. They can leak fluid in the layers of retina, and sometimes they also burst open to cause bleeding under the retina. Now that is the wet variant, which also can be treated with injections and medicines, but also can cause significant vision loss, which may turn out to be irreversible.
So now we'll take some questions which are coming in from our Facebook live feed. What are floaters?
So floater is basically any small opacity which is in the vitreous cavity. I'll talk to you about what vitreous cavity is. And these floaters basically are shadows of these opacities, because we see them against a bright background, they appear black to us. But the floater is any opacity in the vitreous. So vitreous is a gel-like substance which is present inside the eye behind our natural crystalline lens. So actually during our lifetime, this vitreous is transparent because it has to allow for the light to pass in. But sometimes some opacities do develop in the vitreous, either due to simple vitreous degeneration, that means the properties of the vitreous being lost over time, it develops certain small areas of opacification, or there can be sometimes bleeding inside the vitreous, either due to injury or many of these other conditions which I told you. Sometimes there can be cells, inflammatory cells inside the vitreous, that is these white blood cells which are poured into the vitreous cavity because of some inflammation or infection. So all of these may sort of clump together and form these small clump like opacities in the vitreous, and when we look at them against the light, we see them as small white black dots. So they appear like these floaters, or sometimes people see them as like small mosquitoes or insects flying there in their vision field, or sometimes even in the form of wavy lines.
So should they be treated, these floaters? That's the next question.
So whenever a person is experiencing floaters, definitely a detailed examination by an ophthalmologist, especially an examination by of the retina, is extremely essential. If it is due to a vitreous degeneration, then most of the times these floaters will sort of disappear over time and they do not require any treatment. If it is due to any bleeding in the vitreous cavity, then the blood will gradually get reabsorbed within the eye on its own. Okay, but the ophthalmologist will advise appropriate measures so that a repeat bleeding does not happen, and this bleeding can have various causes. So according to the cause, the treatment will be advised, and any inflammatory or infective floater which the patient may have, those will definitely reduce with medicines, either steroids or some sort of antibiotics or antifungal agents, depending upon what is being suspected. But the most common cause of floaters is vitreous degenerations, which is not associated with any other problem inside the eye. So they gradually disappear over time, or sometimes a person just becomes used to those floaters being there in their visual field, and they do not necessarily require any treatment.
Right. What is venous occlusion and CRVO and BRVO?
Yeah. So vein is a thin-walled blood vessel anywhere in the body which carries the blood away from that organ back to the heart, so that the heart oxygenates it and pumps the new fresh blood. So similarly, the retina also has these veins which is carrying the blood away from the retina back towards the heart. Now, sometimes due to some conditions, especially in people who have hypertensive retinopathy changes, these veins they get blocked. Now, so it is called a RVO, or a retinal vein occlusion. Now, CRVO stands for the central retinal vein occlusion, which means the main trunk. After collection of all the small venules, one main retinal venule gets formed, which gets blocked. Then it is called a central retinal vein occlusion. And therefore, because it is the primary venule of the retina, the whole of the retina will get affected. Whereas BRVO stands for branch retinal vein occlusion. So it is just one of those tributaries of that central retinal vein, which is dealing with only a part of the retina getting affected. And because of that, only a part of the retina will get affected in the disease condition, and the rest of the retina will still be normal and functional. So that is retinal vein occlusion and central retinal vein occlusion and branch retinal vein occlusion, that is known as CRVO and BRVO. Now, what happens due to these vein occlusions is, because the vein is occluded, the blood cannot flow forward. Now, because the blood cannot flow forward, there is a back pressure of the blood towards the towards the part of the vein which was lying before the blockage. Now, because of that, the veins get swollen up with blood. Some areas it will rupture, and some areas the fluid from the plasma will also leak out. So there will be edema, there will be bleeding on the surface of the retina. And because now the perfusion or the blood supply is hampered, the retina is also not getting its appropriate blood supply from the arterioles, and it will also start getting ischemic, which means it will not receive appropriate oxygenation as well as its other nutrients, and those areas of retina start dying off. And because it starts dying off, it tries to get more and more oxygenation and tries to create these abnormal blood vessels, and all the subsequent problems from CRVO and BRVO develop from there, the retina trying to get more oxygen.
We often hear of laser surgery for the eyes. So would you like to tell us a little bit about it?
Yes, laser surgery for the eye is actually a very broad term. There are different types of lasers. There are different indications of doing laser surgery. What people commonly call laser surgery for cataract is actually not a laser surgery. That is a phacoemulsification surgery, which is basically an ultrasound energy which is delivered inside the eye to liquefy the cataract and then suck out the liquefied materials out of the eye. So that is one common misnomer or a common misconception, that the cataract surgery is also a laser surgery. The other type of laser surgery, which is usually carried out for people who want to get rid of their glass power, is the Lasik surgery. Now, in this condition, it is actually a laser. It is an excimer laser. And nowadays, we also have a newer variant of laser, which is called as the femtosecond laser, which is also used quite often in the refractive surgery component. There are laser surgeries for the retina also. They are not actually surgeries, but they are laser procedures, because we do not have to do them in the operation theater. They can be done in the OPD basis also. So the laser is basically either an argon laser, which is sort of obsolete now, but it is nowadays a frequency doubled YAG laser, which is basically a green colored laser of a certain frequency with a certain amount of energy. This is shot in the patient's eye, and it has various functions for treating retinal diseases. For treating conditions like diabetic retinopathy, it can be used to close off these small abnormal blood vessels. It can also be used to carefully burn away areas of retina which are not required or which are sort of dying, so that the need for more and more oxygen is reduced. it is also sometimes used to create small additions. That means bonds between the retina and its underlying layers, so that the retina doesn't detach off. This laser procedure has various different usages depending upon what condition we are using it for. So in terms of eye as a whole, there are different laser procedures, not just one. And but in terms of retina, that is called a retinal photocoagulation with a green laser, which is usually done with for these conditions like diabetic retinopathy, vein occlusions, any retinal tears or breaks.
So thank you, Dr. Hoshing, for answering all our questions very patiently. And this was an extremely illuminating discussion about retinal disorders. And I hope, dear viewers, that you've had a good overview of all retinal disorders. And you are well aware that these kind of checks need to be done as often as your doctor suggests. Thank you so much. And please subscribe to our YouTube channel to get the latest information and trending healthcare topics. And then if you also have any further questions on today's session, you know that you can put your comments on our Facebook page or send us a message. Till we meet again next time, stay safe and stay well and stay healthy. See you soon. Thank you and namaste.
Thank you.